This story is real, and to me, it started on the 11th of October, a Saturday at 4 p.m. Do any of you remember what you were doing this year, 11th October, Saturday, 4 p.m.? No? Most likely having fun? It being a Saturday? Well, I was looking forward to the weekend. Saturdays for doctors are busy. So it was a long clinic, and I was nearing the end of the clinic. So there were 2 or 3 more people to see, and my secretary came in and said, "Ma'am, are you expecting any VIPs? Because it's rare to have VIPs, but when they come, they intimate us ahead so they can be sat in a different room and whatever, so they don't feel uncomfortable. Not that we see them before or anything like that." I said, "Not to my knowledge, why do you ask?" He said a lady came in Rolls Royce and they wanted a special parking place, and that's why. I said, "No, whatever, make them sit." So into my clinic walks this 33-year-old lady and with her mother and father. And as we doctors do, we start taking her history. So yes, she's married. She's been married for 3 years. She's now 33. She's never conceived, or at least that's what she said when she was with her parents. And she wants to conceive. And we routinely take a medical history and etc. And in the medical history, she gave a history of long-standing PCOD. She has had PCOD throughout her menstrual life. Right from 13, she's never had regular periods. Her periods have always been irregular. And when we checked her height and weight, she was 5'6" and weighed 106 kilos. So this puts her into an extremely obese category. And as doctors, there's something which is inbuilt in our brains. There are red flags. When people start talking, when patients start telling, they tell so many things, but certain things kind of stick in your head. You think, oh gosh. So now you tell me, she got married at 30, she's 33, yet to have a child. What do you think is an ideal age for marriage? Someone wants to get married at 28, huh? How nice. The average age for marriage in South India now is 31 and in North India is 33, apparently. Google says this. And Google also tells me that for a woman to be physically, mentally and emotionally be ready to conceive. I didn't ask what is the right age for marriage. I just asked what's the right age to conceive a child. Google says 25 to 30 based on all the scientific knowledge it kind of accumulates, because that is when a woman is mentally ready for a baby, to take hold of a baby, responsibility. This woman is already 30 at marriage, 33, no child. 2 red flags. 3, her obesity. A weight of 106 kilos is way too much to invite health problems. So if you start thinking about what health problems might a woman who is 106 kilos have, you can start from head to toe. Heart problems, respiratory problems, musculoskeletal problems. Your feet and your knees have to carry all your weight. Reproductive problems. Women who are obese don't get regular periods. Women who are obese do not fall pregnant when they want to fall pregnant. If they fall pregnant, women struggle to sustain a healthy pregnancy. So 1, becoming pregnant is difficult, and 2, sustaining a pregnancy is even more difficult. So you're looking at problems in her future fertility and PCOD. PCOD was never there. Believe me, when I did MBBS 25 years ago, there was not even a chapter on PCOD. I don't know how many of you know about PCOD. I don't know how many of you have PCOD, and I don't know how many of you have friends, relatives, family members with PCOD. But this single PCOD problem is currently entertaining gynecologists, fertility specialists, reproductive specialists, dermatologists, and whatnot. It's become a bread and butter, but it's a menace and it's affecting 30% of women. So PCOD is, for those of you who are thinking, what's PCOD, what's she talking about? PCOD is where a woman's ovaries are not working properly, they're not secreting female hormones properly. And if a woman's female hormones are not being released, your body's not going to keep quiet. Your hormones are your steroids, they are your strength. Hormone means strength. And that is why at 52, 53, 54, women stop having periods, they go into menopause, and they don't feel so strong anymore. So PCOD is where a woman's estrogen progesterone go down, and to compensate, her body will put weight on, and that fat, the extra fat which is accumulated, will start releasing testosterone, which is a male hormone. So PCOD is where a woman is less woman and a bit of a man inside and outside, because these women put weight on in the upper body. There is more facial hair, there's more body hair, and there's more acne, hirsutism, lack of fertility, lack of periods. So here I'm looking at a woman who has multiple red flags. And what I know and what she knows, which her parents don't know, is a mystery of this story. Which is, I met her the previous year when she came to me with an unwanted pregnancy. And at that time, her husband was in USA, she was in India. She kind of temporarily separated from him because she got a sexually transmitted infection called genital warts. And because they had a fight about this, she came back to India. And he works there, she's a housewife. And after she coming back to India, she got back in touch with a long forgotten boyfriend or whatever, and she fell pregnant unintentionally when she came to me for termination. And here again, in 2024, when I saw her, there were two red flags, totally unnecessary illnesses. You know, there is absolutely no need for anybody to get HPV infections, because these days we have HPV vaccination. We want all school children, we want all boys, all girls, all of you, college boys, college girls, before you enter into sexual relationships, we want you all to be HPV vaccinated. Well, this girl has all the money in the world, she can travel in a Rolls Royce, she could have had HPV vaccination. So I don't know what stopped her, or was she not aware, I don't know, but she never received it. She obviously got some infection from her husband, which was a HPV related warts, and that caused lots of fights, totally unnecessary if both of them were vaccinated. Two, where is the need to get an unwanted pregnancy? In the middle of all the chaos that's going on in her life, do you really need an unwanted pregnancy? Who am I to tell if people should be sexually active or not? But I have every right in the world to tell every woman to take responsibility and use contraception. In addition to condoms, there are multiple female contraceptive options. There is a birth control pill. There is an injection which a woman could have every 3 months, and that will stop her from becoming pregnant. There is an injection which goes into your arm like a matchstick, which works for 3 years. For 3 years, this woman will not become pregnant how many ever times she encounters intercourse. And whenever she wants, we can literally take that little matchstick like medicine out. I don't know how many of you are aware of this. She could have had a coil in the uterus. She didn't need to have this unwanted pregnancy, but she did. She had to face it. And me as a doctor, I'm thinking, why is this girl getting infections? You know, so many people have HPV, but why did she get infected? Let me just check her diabetic levels. So I did a full collage of bloods, and she was deficient for vitamin D, vitamin B12, iron, zinc, magnesium. I don't know how many of you take supplements on a regular basis. I see people who take supplements every single day. They eat 3 times a day, they still take supplements. And then I see people who never take supplements until they fall ill. They get a malaria, typhoid or something, and then they start taking supplements. Why can't we reach a middle ground? Why don't we all take a multivitamin supplement once a week, say for example? How many of us know if we are deficient in vitamin D or not? Every day there are health magazines saying 97% Indian men and women are deficient in vitamins. What happens when you have vitamin and mineral deficiency? You get more infections, you're more prone to diabetes, you're more prone to high blood pressure, you're more prone to autoimmune diseases like rheumatoid arthritis, and you're more prone to cancer. In the last 3 months, there were 3 major papers which said vitamin D deficiency can increase the risk of cancers. So, look, this woman, this lady, Mrs. M, she has had all these deficiencies. She's had an infection. She's had an unwanted pregnancy. I've given her advice about all this. And then this time, actually, she comes to my clinic, you know, with what? Can you guess? No? I'll give you a clue. It's a tragedy story.
Yeah.
I wish it came with a miscarriage. No. Cervical cancer, no. But basically, if you look at her weight gain, if you take history, she was 62 kilos in 10th standard. I always ask, what was your weight when you left school? What was your weight at wedding? Because I can guarantee you my house, I can bet my house, nobody will be as less as they were at the time of wedding. Because wedding means intense starvation to get into that beautiful blouse of your wedding saree. Yes or no? So I said, what was your weight at wedding? 82 kilos. What are you now? 106 kilos. And when was that? 3 years ago. So in 3 years, she's put 26 kilos on. She went back after that termination and wards and fights and everything. She went back to USA. And this is when I'm seeing on October 11th, Saturday, 4 p.m. She's in my clinic. I recognized her. She recognized me. But eye language, she said, don't speak anything. I didn't speak anything. And this time she came with her husband because she was struggling to fall pregnant. In USA, they said you need IVF. So they came for IVF. When they came for IVF, the fertility doctor obviously will do scans, and on the scan, she was found to be having a tumor in the uterus. And this tumor in the uterus, on biopsy, is a cancer of the uterus. PCOD is a risk factor for cancer of the uterus. Obesity is a risk factor for cancer of the uterus. She has 2 really strong risk factors. She never got her PCOD treated. She's still obese. She never managed to lose weight. So I'm having a 33-year-old woman who doesn't have a living child with a cancer in the uterus, and she wants to have a child. And after moving around and seeing about 7 different doctors in Hyderabad, the husband left because they had a return ticket book. They didn't want to waste that ticket, whatever. And she came to my clinic with her parents saying, Google clearly says uterine cancer can be treated with medicines. You're the 7th person I'm seeing, and I want you to tell me you can treat me with medicine. I looked at her MRI scans. The cancer in the uterus was more than 50% of the uterine volume, and we call it unrescuable in the sense I cannot treat it with medicine. She needs surgery. And I clearly showed the MRI films to her. I drew pictures. I explained to her parents that this cancer is occupying a huge volume in her uterus. It cannot be rescued with medicine. She needs surgery. And if she doesn't get surgery, there is a chance the tumor will outgrow the uterus, come outside the uterus, and then it will become stage 3. And the mother started crying. The father got upset and he said, no, we'll get it done. No more second opinions, third opinions. And in this case, the 7th opinion. They said, no, nothing doing. We'll get her operated. Please book her on the list. Please do her right now. Saturday, 4 p.m. They want me to operate on her right then and there. And I said, no, my anesthetist needs to see you. I'll do you on Monday. And I booked her for theatre to remove the uterus. Very sad thing, but we booked her for 13th October, Monday. And I had to ask my anesthesia doctor a favor at 5 p.m. to do all her checkups and whatever, gets that done. And the next morning, I get a message from her saying, my husband is, superstitious about the number 13. He doesn't want me to have surgery on the 13th. I will get back to you.
Sure.
So obviously I have been in this world long enough to know that this woman's probably changed her mind. And I said, fine, let me know when you're ready, because the matter ends there. You can't, how much of a bad I feel for her, I can't go to her house and pull her and bring her to the theatre, yeah? So fine, the matter ended there until the story, I've been thinking about her on and off, but obviously life got in the way. On 13th November, exactly a month later, I get a message from her Doctor, by the way, I'm in USA now. The doctors here are saying that now I'm in stage 3 and that I need chemo. What do you think? And I said, as we already discussed, if you are in stage 3, you do need chemo. We cannot do surgery anymore. It means the tumor has outgrown the uterus. And then, 20 November, Thursday, she again messages me saying, the doctors here say the chemo will make me lose my hair. Are there any chemo doctors in India who can give chemo without hair loss? All I did was I replied no. I went to Sai Baba's temple and I said, Baba, please give her some sense at least now. Okay? This is a very sad story of a very rich 33-year-old girl who has literally spoiled her life due to multiple wrong decisions right from the age of maybe 15. She could have treated her PCOD. There is so much treatment option available for PCOD. She became very obese and she also told me something about her marriage. She said because of her weight, she could not marry somebody she wanted to. I think another way of saying is the person she wanted to marry did not want to marry her because she's so obese. So the family compromised and got her married to a person who is highly educated, USA postgraduate, has a very good job but comes from a very low financial status. And she says this causes multiple issues with them because he will never stop thinking about how much something costs. So even on the day she was diagnosed with cancer and she needed surgery, he went away because the return ticket was already there. He didn't want to pay extra money to postpone it. That's his way of thinking, nothing wrong with that. But see, when you're not optimal in whichever way you look at it, in your education, in your physical health or in your mental health, your life compromises in a big way. You end up rationing your life. You end up settling with something you're not happy with, and that haunts you for the rest of your life. My take-home message to each and every boy and girl in this room is be happy with yourself. Be happy with your physical health. If there is something that's bothering you, get it sorted. Make sure you're not deficient in vitamins, minerals. If you're not into very healthy eating, if that's possible or not possible for various reasons, at least once in a while, get the blood test done, get the supplements. Start supplements at a younger age. Don't wait till you fall ill till you start taking supplements. Make sure your mental health is tip-top. And if it isn't, there is help available. And make sure you're emotionally happy. Don't settle for something just because that something will fetch you a job or money or a big house or a big car or something. Just make sure you're happy, because I think this girl who haunts me in my dreams for the past 3 days, she's been going on in my head. And when Vivek said, "Ma'am, can you tell a real life story?" I thought, what's better than this? There's a lesson to learn at every single point of her life. I just really hope she does well with chemotherapy, because I have a very soft corner for her and I'm ready for questions.
Thank you.